So bone grafting, what's involved? Tell me about that process. And what type of procedures are you even adding bone?
You bet. Great question. Bone grafting is individualized to the patient. There is no one form of bone grafting that's necessarily right for everybody. So we use a variety of techniques and materials, but I will tell you that in a great majority of cases that we treat now, that bone grafting can sometimes be done, oftentimes be done at the time of implant placement. And
Where do you get the bone, by the way?
So it's sourced from either from the patient themselves, from cadaveric bone, meaning human cadaver source bone, or from what we call a xenograft, an animal source, and the most common source there is bovine.
Okay, so it works.
It works wonderfully, and each one of those types of bones has various properties. So based on the assessment that your doctor does of you as the individual patient will determine what type of graft is best for you and what kind of protocol we would follow, but we do it all the time.
Is it painful? Like, is that something you should worry about?
It is
a bone graft is painful?
Most patients say, oftentimes, when we're talking about, say, a single tooth implant, that patient has seen me 4 months previous for the extraction. Say they had a molar removed, and maybe we even did a graft at that time. They say that the graft or the implant, when we get to that point, was no more painful than the extraction itself. And so most patients have been through an extraction and know what that's about. And oftentimes when you know that something's going to be on that level or less, I think it's less intimidating to go through.